دلوقتي أنا بسعدني أقدم الدكتورة دينا رابيه مدرس النيوناتولوجي والبيدياتريكس والنيوناتولوجي في طب عين شمس.
Thank you, chairpersons. I would like to thank my professors and definitely the attendees for attending such fruitful day. I will present a case presentation, okay? Definitely I will not say the diagnosis right now. I did have a 2-month-old infant who was admitted to our NICU with an attack of severe dehydration without an apparent cause of losses. Baby was exclusively breastfed with a birth weight of 3.2 kilograms and an admission weight of 3 kilograms. Is this alarming?
Yes.
Okay. Her natal and neonatal history were unremarkable without any previous hospitalization. Her examination was remarkable for decreased intensity of breast sounds bilateral, but more on the right side, with fine cracks all over her chest with severe respiratory distress. Polyuria was also noted and urine output was on 11 cc per kilo per hour. Is this alarming? Could this be the cause of dehydration? Yes. Okay. She was ventilated and urinary cath was inserted for adequate urine output assessment and labs were withdrawn. DBG showed metabolic alkalosis with a pH of 7.57, PCO2 of 50, and bicarb of 48. Electrolytes, sodium was 105, and potassium was 1.2. Serum chloride was 65, Kiriat and BAM were normal. Is this correct or is it a lab error? This is the first question I asked. Let's repeat the sample. And the sample was repeated and the same result was obtained. Next thing I did, I called Professor Michel because I didn't know what to do. And this was the initial chest x-ray. What about the cardiac shuttle? It's ribbon shape, it's ribbon shape. This could never be a normal cardiac shuttle. So, given this data, the initial diagnosis I thought of was, any ideas? Yes, Barter Syndrome. And I did think of this. So, calcium creatinine ratio was ordered and urinary electrolytes were ordered too. Prompt treatment was started with IV hydration, sodium and potassium replacement, definitely through a central line because I did need to reach 80 milliequivalent per liter. And IV antibiotics for chest infection. CRP result was received and was remarkably elevated 20, and I have the normal from less than 0.5. Unfortunately, initial diagnosis thought of was excluded by the results of calcium creatinine ratio, which was normal, and in view of the absence of the abnormality of the electrolytes in urine. Also, the mother did deny any history of polyuria at home, and she was a highly educated mother. Remember the cardiac shadow in the X-ray? This couldn't be a normal cardiac shadow. So, another look at the patient's data and an alternative diagnosis thought of. Could anyone think of any other diagnosis? Our diagnosis was sepsis with renal affection in the form of tubulopathy. But let me tell you something, I wasn't totally comfortable with this because I did have, was the weight gain appropriate? Is sepsis an acute or chronic condition? It just happened now. What is the cause of this faltering growth? Especially that she responded dramatically to the IV antibiotic therapy and good hydration. So, the alarming thing, as I said, was the inappropriate weight gain. This could be a sepsis right now, but there's definitely a thing underlying. Another look at the patient data, I did find microscopic hypochromic anemia in the CBC and positive occult blood in stool. So, yes, could this be a sepsis right now? And the patient did have a cow's milk allergy, or what we call FPIs, which is the food protein-induced enterocolitis. So I felt maybe. So let's put the patient on a trial of an amino acid-based formula and see. So a trial of an amino acid-based formula was given for 2 weeks, but still the patient is not gaining weight appropriately. What could this be?
Born error?
We also thought of this in the beginning, but it wasn't. She did have a normal serum ammonia and a normal extended metabolic screen. So the clue for diagnosis was, the mother said, I want to tell you something weird, doctor. She tastes like salt whenever I kiss her. I just want you to tell this because I think it's not important, but I want to tell you. And the mystery was solved. A highly positive sweat chloride test with marvelous response to craving. Always listen to the mother's word. So this was a case of cystic fibrosis presented with a PseudoBarter syndrome. And thank you.